the sutures of the skeleton. The sutures have 4 large sutures, and it occurs where the parietal bone, parietal bone meet the frontal bone anteriorly. The sagittal suture, this is the sagittal suture, the one that goes down straight the middle, is where the perineal bone meet at the cranial midline. Now the lambdoid bone is this suture here on this side, the very back, right here, right there. Okay, then we have the lambdoid is where the parietal bone meets to the occipital bone posteriorly. It's back here. It's back here. Okay. Then we have the squamous suture. There is one on each side. It's where the peritoneal temporal bone meet on the lateral aspect of the skull. So this is the squamous here, and then the other squamous is there. And the other squamous suture. Okay, and we have the coronal suture, which is here. Okay, the coronal suture is here, and the squamous suture is here. I'm sorry, I made a mistake. The squamous suture is here, and the coronal suture is here. Okay, and that is the structure of the sutures of the axial skeletal. Okay, we're going to be, I'm going to demonstrate now the facial bones. Okay, this is the facial bone here. The facial skeleton is made up of 14 bones, which I will demonstrate most of them. The mandible and the vomer are not paired. Those are the only ones that don't have 2 of each. All the others do. The maxilla is the bone of the face, and it forms the upper jaw. This is the maxilla here. And it's the jaw and the parts of the hard plate that orbits and nasal cavity walls. And it's the socket for the teeth. It's where the teeth go. And then we have the zygomatic. That one forms the cheek. Okay, it forms the cheeks over here. And it's a part of the orbit that forms the zygomatic arch with the zygomatic process of the temporal bones. So it's over here. Okay, right here. And then we have the vomer, which forms part of the nasal, and the septum, which is inside here, inside the nasal. It forms part of the nasal septum. It articulates with the sphenoid, ethmoid, palatine bones, and the maxilla. Then we have the inferior nasal concha. That's also in the nasal passage here, a little below it. It forms the lower edge, projecting into the nasal cavity, and form the nasal moiety. It articulates with the ethmoid, lacrimal, maxillary, and palatal bones. Okay, that's here and that's here. Okay, this is the vomer in here. This is the inferior nasal concha. Okay, now we have the mandible. This is the mandible. It's the lower jaw, and it is the largest, strongest face bone. It forms the movable joint of the skull with the temporal bone. The mandibular is the body. This is the mandibular here, is where the chin, and it's the notch, and it anchors the lower teeth. See, right here, anchors the lower teeth. Okay, and the angle is each ramus meets here at the angle, which is on this side here. Okay, and then we have the mandibular notch, which is over here in this area. And the coronoid process is an insertion point for the large temporalis muscle that elevates the lower jaw when chewing. Okay, so that is over here in this area. And that is the end of the facial bones. Okay, I'm now going to demonstrate the ribs, which are here. There are 12 pairs of the ribs, okay? And they are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay? Now, it's attached to the vertebral column and the sternum that forms the thorax. Each rib articulates with the body and transverse process of its corresponding thoracic vertebrae. It forms its vertebral attachment, vertebrae attachment. Each rib curve forward, outward, then forward, and then downward. Okay, work its way down. Rib attaches to the sternum. This is the sternum. The first 1 through 7 ribs, which is 1, 2, 3, 4, 5, 6, 7, it attaches to the costal cartilage that attaches to the sternum, making them true ribs. And the reason why they're true ribs is because they are attached to the sternum. Okay? Now, these 3 ribs here are not attached to the sternum itself. So that's 8, 9, 10 are the costal cartilage of ribs, and it joins the cartilage of the ribs above to be indirectly attached to the sternum, and these are called false ribs. And this is what they mean by indirectly. They're attached, but not directly attached. They're indirectly by attaching to another one that attaches to the sternum. Okay? Then 11 and 12, which are these 2 ribs here, 1 and 2 here, 11 and 12, they do not attach, not even indirectly, to the sternum. And these 2 are called the floating ribs. And they're floating ribs because they're just there. They're not touching anything at all except for the vertebrae. Okay? Now the sternum is a dagger shape bone in the middle of the anterior chest wall, and it makes up of 3 parts, which is the jugular notch, which is right here is the jugular notch, and it's the indentation of the manubrium and easily palpated. Then here is the manubrium, the upper handle part, and this part here is the body, which is the middle blade part, and then here is the exoid process, the blunt cartilage lower tip, which ossifies during adult life. Now that is my presentation on the ribs.